Welcome to this short informative video on the 5 levels of prevention in public health.
In this short video, we will explore the 5 levels of prevention in public health, how they are implemented in public health, and provide some examples of each level. Prevention is described as the actions, measures, interventions, programs, policies, and/or legislation which seek to avert the development or progression of disease or possible harm, injury, disability, or death, and improve, maintain, and/or restore health-related quality of life across the lifespan.
Primordial prevention is the most recent addition to the preventative strategies, which consists of risk factor reduction targeted towards an entire population through a focus on social and environmental conditions. Primordial prevention is important because it targets hazards early on to prevent dangers that could end up being fatal, as well as ensuring that lives are being saved. Certain examples of primordial prevention include prevention of non-communicable diseases by exercising and eating healthy, wearing seatbelts in cars to prevent major injuries, and parents who quit smoking upon having young children grow up in their households.
Primary prevention focuses on the actions taken to prevent diseases before it occurs. This is established by improving health habits that cause diseases, eliminating exposures to hazards, and expanding resistance prior to exposures. Vaccines are one of the most effective primary prevention strategies that aim to reduce the risk of infections. Educating the public on healthy behaviors, including exercising regularly, implementing well eating habits, and getting enough rest are also examples of primary prevention. Identifying target settings and populations, recognizing risk factors, developing a plan of action, evaluating possible outcomes, and finally implementing evidence-based research into practice prevents diseases from occurring.
Secondary prevention focuses on early detection to prevent the progression of a disease. Secondary prevention uses methods such as screening measures to detect diseases in the earliest stages before the onset of symptoms. Another method is preventive drug therapy, which is administered at an early stage of the disease. One example of secondary prevention is regularly screening sexually active teenagers for STIs. Another example is isolating and/or quarantining those who are or may be infected with communicable diseases in order to prevent the spread and break the chain of transmission.
Tertiary prevention focuses on those already affected by a disease with the goal of treatment and rehabilitation. An improvement of quality of life is attempted by limiting and delaying complications and restoring function. Examples of tertiary preventions include cardiac or stroke rehabilitation, support groups that allow members to share strategies for improving quality of life, and occupational physical therapy. Prevention of rehospitalization is also a form of tertiary prevention, which improving tertiary care can prevent. Annual spending on chronically ill patients is $1.5 trillion. It is estimated that if 30% of this was allocated to tertiary care and prevention, the annual budget would see a savings of $45 billion a year.
Quaternary prevention are the actions taken by health professionals to protect individuals from medical interventions that could cause more harm than good. A typical example would be a patient who has symptoms that remain unexplained. Within this concept, a health profession would refrain from potential harmful and invasive interventions that lead to unnecessary follow-ups and treatments. The main goals are to identify the risks for over-medicalization, protect from medical invasion, and suggest alternate and ethically acceptable interventions.
Prevention is defined by the 5 levels as mentioned. Preventative care allows you to lead a healthy lifestyle and access treatment when necessary. Starting treatment or changing your lifestyle before a disease starts or while it is in its early stages will help you stay healthy or recover more quickly. Thank you for listening, and email us if you have any questions.